Dude,
quickly.
this
There's
is so
absolutely no
fucking
harm. At
cooked.
worst, there's
We
no
are
harm.
at the
Thank you very much,
mercy
Bobby.
of madmen. We are at the mercy of madmen. Once again, the dumbest, most hysterical losers in American society are getting their wishes be heard and turning it into government mandate. All right, now we're getting to the real fucking fascism.
And it's not that everything's
Here it is.
100%
The moment you
understood or
waited
known,
for.
but I think we've made a lot of strides. Wish it was done a long time ago. Today, we're delighted to be joined by America's top medical and public health professionals as we announce historic steps to confront the crisis of autism. Horrible, horrible crisis. I want to thank the man who brought this issue to the forefront of American politics along with me. And we actually met in my office, is it like 20 years ago, Bobby? It's probably 20 years ago in New York. I was a developer, as you probably heard, and I always had very strong feelings about autism and how it happened and where it came from. And he and I don't know, the word got out, and I wouldn't say that people were very understanding of where we were, but it's turning out that we understood a lot more than a lot of people who studied it, we think. And I say we think because I don't think they were really letting the public know what they knew. The meteoric rise in autism is among the most alarming public health developments in history. There's never been anything like this. Just a few decades ago, 1 in 10,000 children had autism. So that's not a long time. And I've always heard, you know, they say a few, but I think it's a lot less time than that. It used to be 1 in 20,000, then 1 in 10,000. And I would say that's probably 18 years ago. And now it's 1 in 31, but in some areas it's much worse than that, if you can believe it, 1 in 31. And I gave numbers yesterday. For boys, it's 1 in 12. I was told that's in California where they have, for some reason, a more severe problem. But whether it's 1 in 12 or 1 in 31, can you imagine? That's down from 1 in 20,000, then 1 in 10,000. And now we're at the level of 1 in 12 in some cases for boys, 1 in 31 overall. So since 2000, autism rates have surged by much more than 400%. Instead of attacking those who ask questions, everyone should be grateful for those who are trying to get the answers to this complex situation. Because when you go from 20,000 to 10,000, and then you go to 12, you know there's something artificial. They're taking something. And by the way, I think I can say that there are certain groups of people that don't take vaccines and don't take any pills that have no autism.
That's not true.
That have no autism.
If you're less likely to take a vaccine, you are infinitely less likely to go get diagnosed by a medical specialist to see whether you have autism or not. That's it. That's the only reason. Oh my God.
Yeah, virtually. I heard none. See, Bobby wants to be very careful with what he says, and he should, but I'm not so careful with what I say.
Great. Yeah, you're only the fucking
Amish
president.
As an example.
It's good that you're careless with your
essentially
words.
No autism. First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen.
Oh, God.
Is that okay? Which is basically commonly known as Tylenol during pregnancy, can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. That's, for instance, in cases of extremely high fever, that you feel you can't tough it out, you can't do it. I guess there's that. It's a small number of cases, I think. But if you can't tough it out, if you can't do it, that's what you're going to have to do. You'll take a Tylenol, but it'll be very sparingly. It can be something that's very dangerous to the woman's health. In other words, a fever that's very, very dangerous, and ideally a doctor's decision, because I think you shouldn't take it. And you shouldn't take it during the entire pregnancy. They may tell you that toward the end of the pregnancy, you shouldn't take it during the entire. And you shouldn't give the child a Tylenol every time he's born and he goes and has a shot. You shouldn't give a Tylenol to that child. All pregnant women should talk to their doctors for more information about limiting the use of this medication while pregnant. So ideally, you don't take it at all. But if you have to, if you can't tough it out, or if there's a problem, you're going to end up doing it.
Why
the
are
other
they?
thing that I can tell
I don't
you
even
that
know.
I'll
Like,
say
I
that
don't even
they
understand like
will
what the purpose of
maybe
this is.
say
This is
a
just
little
like
bit later date.
this is just a way to
But I
fuck
think when you
people
go for the
over.
shot, you
That's
do
it.
over a 5-time
It's just
period.
pure bad.
Take it
I
over
can't even
5
see any
times
like
or 4
profit
times, but
upsides for any company
take
in
it
this
in
process. You know what I
smaller
mean? Only
doses,
downsides.
and you
It's
spread
just
it out over a period
let's
of years.
fuck it up. Let's
And,
fuck it
they
up
pump so much
aggressively.
stuff into
Who
those
gives a shit?
Beautiful little babies. It's a disgrace. I don't see it. I think it has. I think it's very bad. They're pumping. It looks like they're pumping into a horse. You have a little child, little fragile child, and you get a
Oh God.
vat of. I also, and we've already done this. We want no mercury in the vaccine. We want no aluminum in the vaccine. The MMR, I think, should be taken separately. This is based on what I feel. The
What I feel. My
mumps,
feelings.
measles, and all the three should be taken separately. And it seems to be that when you mix them, there could be a problem. So there's no downside in taking them separately. In fact, they think it's better, so let it be separate. The chicken pox is already separate because when that got mixed in, I guess they made it for a while, it really was bad. So they make chicken pox. Individually, they're okay. When you mix them, something maybe happens. So there's no downside in doing it. It's not like, oh, if you do it, bad things. No, it's only good side. And it may not have that much of an impact, but it may have a big impact. So let those be taken separately. And then hepatitis B is sexually transmitted. There's no reason to give a baby that's almost just born hepatitis B. So I would say wait till the baby is 12 years old and formed and take hepatitis B. And I think if you do those things, it's going to be a whole different, it's going to be a revolution in a positive sense in the country. The FDA will be updating the label of an
unless they're
existing
born
drug to reflect
vaginally.
potential
No,
benefits
stop.
in reducing some autism
You don't understand.
symptoms. This gives hope to
We're
the
making
many
them
parents
born
with autistic
not
children
vaginally.
that finally, to help reach the ultimate goal of ending the autism fever, the NIH will be announcing 13 major grant awards from the Autism Data Science Initiatives. And to be honest with you, to me, that's the least important. It's not even a money thing at this point. There's so much money, but they have to do, and they have to move quickly. When the alternative is that nothing bad can happen, let's do it now. I was just saying to Bobby and the group, let's do it now. Nothing bad can happen. It can only good happen. But with Tylenol, don't take it. Don't take it. And if you can't live, if your fever is so bad, you have to take one because there's no alternative to that. Sadly, first question, what can you take instead? It's actually, there's not an alternative to that. And as you know, other of the medicines are absolutely proven bad. I mean, they've been proven bad with the aspirins and the Advils and others, right? And they've been proven bad. So I'd like to ask Bobby to get up to the podium and say a few words, and then Dr. Bhattacharya and Dr. McCary, Dr. Oz, Dr. Fink, followed by two incredible mothers that have experienced firsthand what this country is going through, what parts of the world are going through. And I will say there are parts of the
Kenview
world
going to have
that
mad
don't take
lawsuits for
Tylenol.
him using the Tylenol
I mean,
brand
there's a
mainly
rumor,
for this.
and I don't know if it's so or not, that Cuba, they don't have Tylenol because they don't have the money for Tylenol, and they have virtually no autism, okay? Tell me about that one.
What? They have paracetamol,
other
dude.
parts of
They
the
have a
world where they don't
paracetamol
have Tylenol,
substitute.
where they
What
don't
the
have
fuck?
Autism. That tells you a lot, and I want to say it right now. And you know the way I look at it? Don't take it. Don't take it. There's no downside in not taking it. So I'd like to ask Bobby to come up and say a few words. I hope I didn't ruin his day, but that's the way I feel. I've been very strong on the subject for a long time. You know, life is common sense, too.
It can only good
And
happen.
there's a lot of
but my
common sense
autism
in
is the
this, and
problem.
I wish things like this were brought up, and this group has worked so hard on it. But I'd like to be a little bit more, a little speedier in the process of a recommendation because there's no harm in going
Dude,
quickly.
this
There's
is so
absolutely no
fucking
harm. At
cooked.
worst, there's
We
no
are
harm.
at the
Thank you very much,
mercy
Bobby,
of
please.
madmen. We are at the mercy of madmen. Once again, the dumbest, most hysterical losers in American society are getting their wishes be heard and turning it into government mandate. We are at the mercy of the most insane people, dude. Whether it be evangelical Christians when it comes to abortion and numerous other fucking hysterics that this administration listens to. or whether it be all of the fucking anti-vax cranks and their consistent advocacy that has led to RFK Jr. becoming a permanent fixture of the administration. That's what this is. They're literally giving red meat to like key constituencies of their fucking base, and they all happen to be schizophrenic hallucinators.
Genetic drivers of autism. And that would be like studying the genetic drivers of lung cancer. The FDA is responding to clinical and laboratory studies that suggest a potential association between acetaminophen used during pregnancy and adverse neurodevelopmental outcomes, including later diagnosis for ADHD and autism.
What do I say, man? What do you say to this? What do you fucking say to this? What do you say to this? It's so cooked.
We have also evaluated the contrary.
This is so dumb. I don't know. I don't even know what to say. We're literally, his brainworm is running the health initiatives in this government.
Pregnancy and begin the process to initiate a safety label change and the use of acetaminophen for fevers and pain in pregnancy by prescribing the lowest effective dose for the shortest necessary duration and only when treatment is required.
Oh, so they can have a little bit of autism, I guess? Is that what it is?
Of science that deliver actionable information to parents
Oh
on
my God.
underlying causes
What do you,
of
I mean,
autism and
beacon
the
of
potential
health,
paths
baby.
for prevention and reversal. Finally, autism is a complex disorder with multifactorial etiology. We are continuing to investigate a multiplicity of potential causes with no areas of taboo. One area that we are closely examining, as the president mentioned, is vaccines.
You want to know the worst part of this? People are talking about his hand, right? These assholes never actually take the anti-science, anti-medicine rhetoric to heart. When doctors come to them and say, this is what you got to do, they don't go, no, actually, I'm going to inject fucking bleach. That's the worst part about this, because they don't even fucking practice what they preach, bro. Because if they did, they wouldn't be here for long. RFK does? Yeah, well, he's on the verge of collapse. Exactly.
Whatever the answer is, we will tell you what we
Out of these
find.
three, this fucking piece of shit, by the way, is a real doctor. So for him to also play this song and dance is, of course, expected, considering if you know his background, you know that he was already prosecuted for selling snake oil. Okay? But he's a real fucking doctor. It's crazy. He knows exactly what these kinds of idiotic decisions are going to lead to. But he doesn't give a fuck, because I'm sure he has a stake or something in whatever they're presenting as the cure to autism.
The great thing about the new NIH initiative on autism is that scientists will use rigorous advanced methods in causal inference, machine learning, organoids, and other fresh approaches to the problem.
They're gonna fucking
The sharp
AI
rise
it.
in the prevalence of autism deserves
machine
an
learning.
urgent
Oh,
response by the
lordy.
scientific community. As Bobby said, the NIH has invested a lot of money to study autism over the years.
Oh,
but
brother.
the research has not produced the answers that families and parents of autistic children deserve, and autistic children themselves deserve. For too long, it's been taboo to ask some questions for fear the scientific work might reveal a politically incorrect answer.
Oh my
Because
God.
of this restricted
Woke.
focus in scientific investigations, the answers
we're
for families have been
eradicating
similarly
woke
restricted,
from autism
often pointing families to
research.
behavioral therapies that don't work for every kid, or suggest non-modifiable genetic factors as the cause. But genetics alone can't explain such a sharp rise in autism prevalence over just a few decades, as the president said.
Dr. Bhattacharya. Mr. President, this is the start of a historic shift in medical culture. This administration is working together to ask big questions about why our nation's children are getting sick.
He ain't
so
wrong.
fast.
It is. It's just not in a good
Medicine
direction.
is doing small little studies, giving us answers we already knew. But we've got to make a difference. You've given us a charge to identify root causes, and we are not going to stop so that we can end the suffering we are watching. And if you've seen a kid with autism, with severe autism, it's hard to watch.
Also need to understand something here. Not only is this like not a curable disease, but it's also not like a severe setback. So the way that they're presenting this as a as a curable disease is only going to stigmatize people with autism further. It's fucking nutty. This is just like, it's just eugenics, it seems like.
Between acetaminophen in pregnancy and autism. And the Nurses' Health Study with researchers from Yale, Columbia, and Harvard looking at 9,000 kids found that acetaminophen use in pregnancy was associated with neurodevelopmental disorders.
What if they
And
find
4
autism
weeks
to be
ago,
inherited?
a Mount
I mean,
Sinai
it is.
Harvard
It
study
is.
reviewed all
It is
the existing
inherited. Will they
literature
start a
and
sterilization
found the
campaign?
overwhelming body of evidence points
Hope
to an
not.
association. A study out of Hopkins actually showed that treating a fever can prolong the duration of illness in a young kid. Maybe that's because a fever is a
Wait,
body's
what?
natural way of ridding an infection.
Wait.
When my wife was
This
pregnant
guy's
and
a
delivered our son
doctor.
a few months
Ain't no
ago,
fucking
they
way.
pushed her to take
How?
acetaminophen for a
How is
low-grade
that
fever.
possible?
She said no, and then they looked to me and I said, absolutely new. I'm also here to announce good news. Today, the
Is he a
FDA is
Christian
filing a Federal
Scientist?
Register notice to change the label on an exciting treatment called prescription leucovorin so that it can be available to children with autism. You know, autism may also be due to a autoimmune reaction to a folate receptor on the brain, not allowing that important vitamin to get into the brain cells. It's a fairly established, mature pathway.
Bro,
Again,
some
we have a
fevers,
duty to
if
let
left
doctors and the public
unaddressed
know we're
with
gonna
medical
change the label to make
intervention,
it available.
can cause permanent brain damage and even kill people. What the fuck are we talking about,
Chronic
dude?
folate deficiency.
The response to the autism crisis is going to continue to
I
come
can't
to you.
believe how
under
many people are
Secretary Kennedy's
television
leadership
guys,
and
by the way.
President
Dr.
Obama
Ross,
and
even
other
RFK
ways you've
Jr.
heard. The
Like,
FDA
this is the podcast, their
based on
television
NIH
administration.
research, is approving prescription leucovorin for treatment of autistic children. Now, if you're following the script, there should be 2 questions that you have. 2 questions that should come to your mind. The first is, how will patients and parents get access to the treatment? I'll tell you how. Over half of American children are covered by Medicaid and CHIP, government health insurance. Over half.
Well, they're
Therefore, because
cutting
they're
that
covered
too.
in Medicaid and CHIP, upon this label change by Marty, state Medicaid programs in partnership with CMS will cover prescription leucovorin around the country. It's yours, but you have to go to a doctor to get a prescription because they know your child, they know you, and they know the medication. States will also have tools to monitor its use and ensure appropriate utilization. That's important for a bunch of reasons because we want the right kids getting the right prescription medications. We believe private insurance companies will rapidly follow our lead if they have not already done so. So let me introduce Dr. Fink, who's acting administrator, and after Dr. Fink, we've got some wonderful women, Jackie and Amanda. If, I know it's going to be tough, but if you can make some comments about this
Bro, they're
historic
talking
day. God
about
bless.
autism like it's like AIDS. They're talking about autism like it just like kills you. If you have the tism, you're cooked.
As a pediatrician and
And
mom,
not just like have, you know, varying degrees of hyperfixations on fucking trains and shit. You know what I mean? Or you're like a numbers guy.
of whether to take acetaminophen during pregnancy. It's hard to hear information
look at
that
kids with
challenges the status
autism.
quo. We are sharing this information not to confuse, but to
Same
empower
with men
parents to make the
kissing.
best choices when taking medications during pregnancy. We are all
Please
concerned
stop.
about
Some
the
kids
rising
have it
rates
worse than
of
you know.
neurodevelopmental
Shut the fuck up. I do know.
including
That's why I
autism.
said to varying degrees.
President Trump
It can
and
be
Secretary
debilitating, but it's simply
dedicated to
not a
radical
fucking disease.
transparency.
Oh my God, chatter.
We are also sharing this information with our nation's doctors, and we encourage you, as always, to consult with your doctor to make the best decision for you. All too often, it's easy to think that medicines we buy without a prescription pose little to no risk for the mom or the baby. As you heard today, pregnant women who need high fever or pain reduction during pregnancy should take the lowest effective dose of acetaminophen for the shortest possible duration. Most women will not meet these
Yelling
indications
at us on
during
won't
their
help when you have the
pregnancies.
president and staff up there straight up lying about it.
I am encouraged
Yeah,
by these developments
The
today.
administration is
because
like
it
one
another
step removed from putting all autistic people that they've branded as autistic into fucking camps where they sterilize them by force. And there are parents in here with autistic children fucking yelling at me because I didn't like sufficiently talk about some of the worst aspects of this spectrum.
I have a son who's 5 who is profoundly autistic. And you've probably heard if you've met one autistic child, you've met one autistic child. It's a spectrum, which I don't think the spectrum is helpful, but that's another
What?
conversation. He is an amazing little boy.
She's just
blessing.
dunking on her kid, bro. I got a 5-year-old with the full-blown tism.
He's marvelous. It's not even that he can't speak. Sometimes he just doesn't understand what I'm saying. He understands the word no, but he doesn't understand the why behind the no. And that's a huge part of discipline. That's the discipline. So it's very hard to discipline a child with autism, so you have these behaviors. And it's a very hopeless feeling. It's very isolating being a parent with a profound autistic child. Even just taking them over to your friend's house is something we just don't do because, again, they're going to be met with no, 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 and no understanding of why. And then there's a meltdown. And then you're in a situation where you're just helpless and you're just trying to protect your kid. So it's just better not to do it. You learn your limits, and it's been really hard. This is amazing that we're here today. And no one has been able to point to anything to say this is what caused it. And you can't point to that and say it didn't cause it. I have no idea. I am completely open, not blaming anything, but I'm open to the discussion and the fact that there's work being done to find answers. I'm very grateful. I was already excited to vote for Mr. Trump anyway, Mr. President. But when we got word of RFK doing his work, I was ecstatic. I could not wait for this work to be done, that somebody would try to find us some answers. I'm just very grateful. I pray for my son
according
every
to
day.
Trump, it's because you fucking ate Tylenol when you were pregnant. How does that work? Yeah, you did this seemingly horrible thing to your child because you presented as this horrible disease that you've inflicted upon your child.
So my son is Eddie. He's 11. He's on the opposite end of the spectrum from what Amanda just explained. He's considered high functioning. He was not always high functioning. He was nonverbal till the age 4. We've had quite a hard time to get to the place where we are today. I am just so grateful to President Trump and the entire administration for finally listening to
high functioning, low
moms
functioning is the
who have been
older
crying out for
terminology that
help,
used
for
to be
answers for
used. I
years.
think they
I've
changed it.
met
There's
so
always
many other
patches on
moms
this
with
stuff,
children on the
but
spectrum in the 9
but it
years
just
since
means
my
that like
son's
high functioning just means
diagnosis.
that you don't need like a lot of
And they all have
assistance in
very
terms of
similar
like
stories,
socializing.
and they've all
You don't have like
just wanted
significant
somebody to
medical,
listen,
significant
to
dietary
not
restrictions,
ridicule
things of that
them
nature.
Or take the
I
time
think
to
the
really
new
listen
meta is to
and
say
find
like
out when the
support
change happened
needs
and
or
what change
something,
happened.
right?
And it's just
Back in my
I've been
day, it
praying
was
for
high
this day
functioning, low
for 9
functioning.
years, and I'm so thankful to God for bringing the administration into our lives. And I'm speechless. This day is a day I never thought would happen. I thought that we would never have an administration that was courageous enough to look into things that no prior administration had. So I'm just here to express my gratitude, and I am
It's
looking forward to what
full-blown
comes
read a health
from this,
journal.
and hopefully
Yeah,
we just get more
full-blown
answers.
autism.
So thank you.
Thank you very much.
Full-blown autism.
So I just want to say acetaminophen is basically Tylenol, and I just recommend strongly.
What's the smoke that these motherfuckers have for Johnson & Johnson, dude? They're just like, seems like they're just singling Johnson & Johnson out as like
Maybe
Tylenol
10%
making you
of the women that are
autistic. Don't
pregnant
take it.
are, would perhaps be forced to use it, and that would mean you just can't tough it out. No matter what you do, you can't tough it out. So that's up to you and your doctor. But there's a very strong recommendation, maybe stronger from me than from the group because they're waiting for certain studies. I just want to say, I want to say it like it is. Don't take Tylenol. Don't take it.
There's
You
other
just
acetaminophen
can't-
generics out there.
Fight like hell not to take
Like,
it.
I have it right
There
here.
may be a point where you have to, and that you have to work
this
out
is why,
with yourself.
This is
So
why
don't take
I have the
Tylenol.
full-blown
Other
tism.
things that we recommend, or certainly I do anyway, is, and it's so important to me, to see the doctor 4 times or 5 times for a vaccine. Don't let them pump your baby up with the largest pile of stuff you've ever seen in your life going into the delicate little body of a baby, even if it's
Delicate
2
little
years,
body
3
of
years,
a
4
baby.
years. You just break it up into, I would say 5.
doing
but
it.
Let's say 4. 4
I'm
visits
doing
to the
it.
doctor instead of 1. And certain
my
things
neck
I think
pain.
you should do. We've already taken out and are in the process of taking out mercury and aluminum now. You know what mercury is. You know what aluminum is. Who the hell wants that pumped into a body? And there were rumors about both of them for a long time. But we're having them taken out. We're having them taken out of the vaccines.
And guess what?
Hepatitis B, again.
I'm pregnant. I'm pregante. I'm MPreg. And I just took some fucking acetaminophen, dude. Goddamn. You already know. I'm trying to make sure my next of kin, this baby, that's coming out of my butt, is going to be the most autistic.
Common sense, and they have that too.
Mega autism.
They have that too a lot. If you're pregnant, don't take Tylenol. When you have your baby, don't give your baby Tylenol at all, unless it's absolutely necessary. Don't
What
do
is
it.
this?
Break
Was
up
that
your
even a
visits
part?
to the doctors.
Was
Break
that
them
even a
up.
part of
Put
what the
in 5
doctors
if you
were
can.
saying? Or I
No,
mean,
it's inconvenient. It's inconvenient.
I made the
No, you're gonna
mistake
have
of
to go
claiming the
back, 'cause then
doctors
you're
are
later.
saying
You're gonna
this.
go back each year for 4 years, 5 years, 3 years. Just break it up. Break it up, because it's too much liquid. Too many different things are going into that baby at too big a
many
number.
liquids are going
the
into the
size of this
baby.
thing, when you look at it,
He's
it's like
fucking
80 different
freestyling.
vaccines and beyond vaccines. But for years we've been hearing how bad MMR is as a combination.
No,
and I'm
we
very
haven't.
happy that you broke out chickenpox, because that was
we
really
haven't.
a problem.
No, that's not
there
a
are
thing
other
that we've
things.
been
It's interesting,
hearing.
because there are other things.
Hear other things.
We're talking about other different drugs, pills that you take that we know are so bad, and they don't take them
my
anymore. But for some
God.
reason, with this, they keep taking it. Don't take Tylenol.
Trump used
There's
platform
no
of presidents to
downside.
promote unproven
Don't
testing
take it.
Tylenol vaccines, autism without new
You'll be
evidence.
uncomfortable. It won't be as easy, maybe, but don't take it. If you're pregnant, don't take Tylenol. And don't give it to the baby after the baby is born. And you know what? We have more than 3 years left. And I told Bobby and the doctors behind me, and they are so committed to this, like an Ozempic or I call it the fat pill or the fat drug. Sometimes it works, I guess, for people. The ones I've seen,
Oh
it
my
hasn't
God.
worked so well. I got a lot of friends, they're fat. And they said, yeah, I lost some weight. I said, you don't look it to me.
I have one on your announcement, one on vaccines that's also related.
Yes.
Why do you think we haven't heard more previously about the tie to
Woke.
autism and acetaminophen?
Goes
Nobody
woke.
knows. I don't know. Not only that, when you say it, you get attacked. I was saying something similar, not as strongly, because now facts are on our side. But I was saying it with Bobby 20 years ago, and I was attacked. I said, whoa, what was that all about?
Trump has
I had
always
no
been a
idea.
vaccine skeptic and talked about how too many vaccines is what causes autism. He used to say that all the time.
Drug companies, doctors, I don't know what it is. All I want to do, I don't care about being attacked. It doesn't matter to me. I believe that the numbers at the end of our term or shortly thereafter could be really phenomenal. I want it to go up, just like it came down to this horrible level. 1 in 10, 1 in 12. I was told 1 in 10. I was told 1 in 12. Today I heard 1 in 31 if you add the girls and the boys together. It's crazy. And it was 1 in 10,000 and 1 in 20,000. It's not even sustainable for a country. You want to know the truth. And there are other places that don't have it.
That's not true.
And they have things in common.
That's not true.
And that's called medical
That's literally
research.
not
Please.
true. If there are no autism diagnoses taking place, that is a matter of diagnostics, not a matter of there's no autism in those countries. And considering that this is seen as a spectrum in terms of like the social component, okay, many people that have it, including like older generations of people that have it, might not even know that they have it. They're just, back in the day, look, this is fucking broad. This is very broad, right? Back in the day, when someone was autistic, they would just go, he's a little weird, okay? That's it. Especially if they were like low needs or low support needs autistic. They would just go, that guy likes math. That guy's a little weird. It is what it is, okay? That's it. And then they would lobotomize the people with high support needs. Okay, that's how they used to do it back then. Now, obviously, that wasn't great either. Okay, but that was it. They would just be like, oh, he's eccentric. You know, yeah, your grandmother that collects spoons, just a little eccentric. Your uncle that loves model trains, just a little eccentric. That's it. The idea that this is like not seen elsewhere is just a matter of diagnostics. And considering that this is not like a disease or anything, like it's just more so a matter of normalizing. It's just more so a matter of fucking normalizing the way that the way that people deal with autism that they have, and also other people that have a better way of
that's at odds with what you said.
socializing with people who have autism.
to doing, other than a mother will have to, as I say, tough it out a little bit. There's no downside to doing this. It's not like, oh, if you do this, you're going
there's
to
no
die.
downsides
There's no
to
downside.
the unlimited
There's no
amount
downside to
of
going over a 4-year or 5-year
unsubstantiated
period or a 3-year period.
medical
Or even if you
skepticism
space
that
them
we
out for
just
6
presented,
months.
and also
You
the
space them out.
fact that
There's no downside.
I even doubled
And that's
down
why
on
I
another
will say, the
unsubstantiated,
gentleman
totally
behind me,
ridiculous statement
they have
about
very strong
vaccines.
views, and they feel
No
that
downsides
we're right,
whatsoever to vaccine
but they'll have more
skepticism,
research done
except
over the
for
next 2 months. I said, well,
previously
2 months is a
combated
long
diseases
time.
coming back because
lot of
people are just
people
not going to get
could be
vaccinated
sick.
for it.
And there's no
Oh my
downside
Lord.
to doing it. Everything I said, there's no downside to doing it. It can only be good.
Oh my God, bro. I mean, let's be real. This was like, what was the alternative, you know? What's the alternative? Of course this was going to happen. Of course this was going to happen. And this is just the beginning too. It's going to get even worse than this. You let the fucking madmen run the asylum, and this is what's gonna happen. I guess, like, in some ways, I thought that while liberal capitalism is in decline, corporate interests would still offer some significant setbacks to this administration accelerating the decline, you know, because, like, you just don't want, it's not good for even the capital owners if, like, people are this stupid. Right? If they're anti-science, anti-medicine to this degree, it's still not good for the profit margins, right? But it turns out there's nothing people can do. These guys are just gonna do whatever the fuck they want. I cannot believe it. It feels so insane that this is the administration, this is the government, this is the president. These are the people running the FDA and the CDC and the HHS. This PhD organic chemistry guy says, RFK Jr. is set to announce Tylenol causes autism, and then it'll push to cure leucovorin, folinic acid. Who sells folinic acid? Dr. Oz's supplement company, iHerb. Think about that. A government health official tied to the very supplement company that benefits from RFK Jr.'s bogus cure. This is in public health. Is corrupt. It's corruption dressed up as wellness. We're so cooked. We're so unimaginably cooked. Here's the most recent and largest study I could find. Folinic acid modestly reduced autism severity in a 2024 RCT with the biggest gains in kids with folate receptor autoantibodies. Safe, but the benefit, give or take 1 point on CARS, may be too small to be clinically meaningful. A 24-week double-blind trial tested high-dose folinic acid in 80 children with autism ages 2 to 10. Both placebo and treatment groups improved. A million studies that prove that Tylenol is the least consequential inflammatory drug that pregnant parents can take didn't mean anything. A study on the opposite side that says folinic acid could be helpful in reducing some of the aspects of autism. You know, all systems go. Dope, man.